Well, Leanne, one of the worrying issues coming out of this area is the infection rate. It is very, very much high. It's sitting at about 36%. In fact, when I was doing my research on the area, I discovered that it was 36%. But the lady that I am with now was actually telling me that it's actually 38%. The HIV and AIDS infection rate of the smaller area, it's at 38%. Well, let's talk more about that issue with the deputy chairperson of Mlalazi Local AIDS Council. She is Hilda Khuluse. Ma'am, sawubona and welcome to Morning Live.
Thank you.
The infection rate, as I was saying, that I had actually thought it was at 36%, and you're telling me that it's actually 38%. This number is quite high.
Yeah, it is. It is 38%.
Okay, but what are the contributing factors here?
I think it's rape. Elder people, they got that thing that if they sleep with the younger people from 9 to 11, they will reduce or they'll finish the AIDS. And another thing is what some people are defaulting in taking tablets because of, we call it, it's not like a stigma before, it's an inner stigma now. That's what my neighbor gonna say if he sees me in the clinic. Because in the clinic or hospital, they are saying, if uhlala elokishini, wathatha elokishini, kuleyo ndawo uhlala kuyona. So abantu bese beyasaba wathatha la behlala ngakhona ukuthi bazothina omakhelwane. I think that's another problem.
So that shows that stigma is very much prevalent in this area.
Yes, it is, but it's not like the stigma before, like saying ngine HIV. It's an inner stigma now, saying umakhelwane wami uzothini. Yeah.
So that's why people are defaulting on their treatment. The issue of rape, like you're saying, are you telling me that there are still people believing that if they sleep with young virgins or young children, they will get rid of their HIV status? Is that what you're saying?
Yes, it is. Like now, there's a small area, they call it Kanini, Eshowe. I think we got about 16 or 17 cases of rape. Another case we have right now, that will be on the 14 to 15, is for the teacher who raped 27 kids in primary school where he is.
One teacher allegedly raped 27 kids?
Yes.
So where is the case now? Is it still in court?
The case is on. It was postponed for 14 and 15 June.
The level of education here among the community members, are the people aware of HIV and AIDS? Do they know enough, or they still lack knowledge in terms of what HIV and AIDS is?
Although they know, but they are those growing kids which they don't know much. What I can say, when TAC was around, you know, TAC, they are bankrupt now, there's no money for the campaign. They were helping a lot. I understand that those small kids are growing. Like, kukhona abantwana abakhula nogogo bedla amaphilisi beshiwe abazali babo. They don't understand ukuthi amaphilisi abo awanogogo bakhula bebatshela ukuthi amaphilisi omkhuhlane. When they turn 15 or 16, mhlawumbe ugogo seshonile bawashiya phansi amaphilisi. So those kids, they still need education. Yeah. And the NGO was doing the best advocacy in that. It's TAC. TAC is no longer alive.
So that's a problem. The issue of medical circumcision, you were telling me just off air now that that's actually contributing, because people actually think that if they have gone for their medical circumcision, then they will not be prone to HIV and AIDS.
Yes. Banalenkolelo yokuthi if umuntu omdala ulala nengane from 4 to 11 years izophela HIV. That's why we got about 16 cases in one small area.
No, that's quite scary, but thank you very much for your time. Thank
you, Mama.
Thank you very much. There you have it. That's Hilda Khuluse. Excuse us for that. That's Hilda Khuluse. She is the deputy chairperson for Mlalazi Local AIDS Council, talking to us about the HIV and AIDS issues here in the area. 38% infection rate here in this area, and she is basically saying that some of the factors that are contributing to this large number is the belief from some people that if they sleep with young girls, they will get rid of their HIV and AIDS status. The medical circumcision also playing part, as she is explaining. So those are some of the worrying factors, Leanne, as you were asking earlier on what are the issues that we discovered when we got here. HIV and AIDS, very much prevalent. So, well, it's back to you, Leanne, for now. I think when you come back to us, we'll be wrapping up with a historian, like I was saying earlier on, that the area has got a rich history and rich heritage. It's back to you now.
Often.